Hi, my name is Zarezza. My group members Emily, Monica, Josh, and I are presenting our project on certified nurse midwife. We took an interest into this specialty of advanced practice nursing because there is a need for more highly skilled certified nurse midwives to be present and integrated into today's health system. Employment of nurse midwives is projected to grow 25% between 2014 and 2024. And in addition, there is this growing desire for women to experience childbirth with little to no intervention. The idea of allowing their body to do what it's genetically engineered to do. And certified midwives are perfect for guiding that process. So what is a midwife? A midwife, first and foremost, is trained specifically to address uncomplicated healthcare needs of women. They function similarly to an obstetrician or a gynecologist, except their practice is tailored to education, prevention, low intervention type services to include gynecological exams, family planning, preconception care, prenatal care, labor and delivery support, newborn care, and even menopausal management. Midwives also provide reproductive education, education on pregnancy health, breastfeeding, and newborn care or infant care. They can be employed in various settings. It could be the home of a patient when it comes to home birth, or a birthing center, or at a hospital. Midwives often function as both a quality and economical option for birthing care. Studies have actually shown that when midwifery care is involved in low-risk pregnancies, involving less medicalization of the birthing process, that it lowers the rates of cesarean sections and decreases the use of vacuum or forceps-assisted deliveries. In addition to that, it's said that they do have a great deal more time with the patient, so they're able to address the patient's needs more holistically. According to the American College of Nurse Midwives, also known as this ACNM, the benefits of CNM assisted births include, like I previously stated, lower rates of cesarean births, lower rates of labor induction and augmentation, a reduction in perineal tears, less use of anesthesia, high rates of breastfeeding, I'm sure due to the increased education and encouragement. Additionally, women cared for by CNMs were more likely to receive prenatal education with a more hands-on approach. They develop a deeper relationship with their provider and fewer technological or invasive interventions. And then from a financial standpoint, just again, they have increased access to care and less invasive medical interventions, reduction in cesarean births, and reduction in pharmacological interventions. So the diagrams on the bottom are related to a study I found called Mapping Integration of Midwives Across the United States, Impact on Access, Equity, and Outcomes. Additionally, they had a team collect data across the 50 states pertinent to environment of midwifery practice and interprofessional collaboration. 110 items were detailed, and then they narrowed it down to 50 items to create something called the Midwifery Integration Scoring System, also known as MISS or MISS. This was used to assess the integration of midwives and evaluate regional access to high-quality maternity care. They also gathered data from CDC Vital Statistics database concerning maternal newborn outcomes by state, as well as the density of midwives in the area and places of birth. They used this to correlate and came up with a linear regression analysis that was conducted. Altogether, if you look at the bottom right diagram with the green bar chart, these were the MISS scores from the 50 states, ranging the lowest was 17, North Carolina, and the highest was 61, which is the state of Washington, out of 100 points. They concluded that in the United States, the higher the MIS scores were associated with significantly higher rates of physiological birth, less obstetric interventions, fewer adverse neonatal outcomes. The MIS scores also correlated with density of midwives and access to care across birth settings. The purple chart over there down with the United States, the darker purple just shows how dense the midwife profession is in that state. The deeper the purple, the more access there was. And so ultimately, this study suggested that integration of midwives into regional health systems is determinant of optimal maternal and newborn outcomes. The requirements for becoming a certified nurse midwife include 6 years of higher education, meaning after graduation from high school, you will need a Bachelor's of Science in Nursing from a CCNE or a ACEN accredited school. And then prior to admission into a midwifery program, you need to submit an application to your local state board of nursing, and you need to pass the NCLEX. Candidates that apply, typically they recommend 1 year of experience working as a registered nurse, preferably with an emphasis in OBGYN care or women's health care. After acceptance, it takes about 2 years to complete a graduate degree, a master's from a 2-year accredited by the Accreditation Commission for Midwifery Education, also known as ACME or ACME, looks like. And then after completion of your education, you again sit for a national certification exam to become a CNM. Candidates must pass the examination offered by the American Midwifery Certification Board. It's a 175 question multiple choice exam, computer based, just like the NCLEX, offered at several sites around the United States, and you're given again 5 hours to complete the exam. To maintain accreditation, certification, it expires every 5 years. You can either renew it by sitting for the exam again and paying the $500, or you can keep up to date with your 20 credit hours, similar to maintaining your license, your registered nursing license, just your continuing education and renewing within the time frame.
Hi, my name is Emily, and I'd like to tell you about the CNM, or Certified Nurse Midwife in Professional Practice. The Certified Nurse Midwife is an advanced practice registered nurse who has gone through graduate school and obtained additional education and training in order to be able to become an independent practitioner. They provide primary, gynecologic, and pregnancy-related healthcare services to women through assessment, diagnosis, treatment, and prescription management. They can admit, manage patients, and discharge patients from outpatient and hospital facilities. They provide health promotion and wellness counseling as well as family planning. Health promotion and wellness counseling as well as family, childbirth, and preconception planning. Collaborate with other healthcare providers as needed to ensure that their patients receive the best care possible. A CNM practices autonomously and does their own assessment, diagnosis, and treatment of the patient, as well as evaluation of the patient after the treatments. When providing care, they must adhere to the standards of care within their scope of practice. Standards of care set forth of practice for a CNM, set forth by the American College of Nurse Midwives. They must be a qualified practitioner, which means they must have completed the education and passed these boards to become a CNM. And by doing so, they will have completed the core competencies. They must provide safe, quality, and ethical care in alignment with the ethical code set forth by the American College of Nurse Midwives. The American College of Nurse Midwives sets forth the core competencies that a qualified practitioner must meet in order to be able to practice as a CNM. The art and science of midwifery. There are professional responsibilities associated with that. They must know in depth women's health and newborn care, the fundamentals of growth and development across the lifespan, the anatomy and physiology of women and newborns, and the development of women and newborns throughout the lifespan. They have to provide safe, quality, and ethical care according to the standards set forth by the American College of Nurse Midwives. Collaborative patient management in order to make sure the patients get the best care possible. Base practice to conduct patient care when providing treatments, doing assessments, and giving patients medical advice.
In conclusion, certified nurse midwives are a master's level prepared, certified advanced practice nurse. They are involved throughout an individual's pregnancy and provide education at every stage. CNM involvement has been shown to lower the incidence of cesarean sections and reduce the use of invasive delivery methods, such as the use of vacuums or forceps, which may be harmful to the infant during delivery. CNMs also help educate new mothers in breastfeeding and general newborn care. CNMs are becoming an integrated part of the professional healthcare system to allow mothers to take a more natural approach to childbirth while maintaining a safe, educated, and nurturing environment.